Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Janine Cook-Garrard, and I'm here with a nursing student, Balia Wilson, from Nassau Community College's nursing program. And we're both from the Department of Nursing here at Nassau Community College. And today we're going to discuss holistic health care and chiropractic care. Our guests today are Stephen Pfieffer and John Mathai, who are both interns of chiropractic medicine at the Levittown Health Center. Welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. So tell us about your path as it was or is at the Levittown Health Center. What made you want to be chiropractic physicians?
Okay, well, I started out on my chiropractic journey in 2013. I got done my undergrad in psychology and math, and I wasn't really sure where I wanted to go. And so I decided to give personal training a try. I knew I liked working with people, and I liked exercise, so I thought I'd try that route. While I was there, working as a personal trainer, I met some massage therapists, and then so I got my massage therapy license, and then I started working for a chiropractor, and that got me interested in chiropractic. And so then in 2016, I started my chiropractic school in upstate New York at Seneca Falls at New York Chiropractic College.
So just explain to us, what is the difference? What is chiropractic medicine? And how does that differ from regular medicine? What is the focus?
The focus of chiropractic mainly is we focus more on conservative treatments. So we looked into the function and the overall movement of the body. So there's many things that can cause the body pain. So we look into the biopsychosocial model, and then we follow an evidence-based approach as well. So we focus on that more of that model. So it's more conservative treatment, and while medicine, it's more, you have medication, pharmaceuticals, then you have invasive with surgeries. But I would say chiropractic and medicine, we also complement each other as well. Because for a lot of treatments, it should be very conservative treatment first, and then followed by, if the patient obviously doesn't succeed with conservative treatment, either if it's chiropractic or physical therapy or any other kind of conservative treatments, then that's where we move down the road to any kind of surgical procedures or into medicine.
So it's a holistic approach.
Holistic approach, exactly.
So tell us about a holistic health care. What is that, and how can people accomplish a holistic approach to health?
Right, so a holistic approach would be you're really looking at the whole person, and so you're trying to, for us as chiropractors, we primarily focus on people who have musculoskeletal associated pain. And so when we see that person, we're looking at them and we're saying, okay, where is this pain coming from? Why are they in this pain? And so to shed a little bit of light on this, I'm going to take, for example, patient A. And so we have this patient A, and she works as a receptionist, and she picks up the phones and, is working as a receptionist at a company. And throughout her day, she spends the majority of her time sitting. She spends the majority of her time sitting. And so that puts biological pressure on her back. And so she comes in and she sees a chiropractor for treatment. And so as a chiropractor, it would be easy for us to go ahead and just adjust this patient and maybe do a little bit of soft tissue and then send them on their way. But what we're trying to do, and as the chiropractic community and the medical community in general, is using this biopsychosocial model. And in the biopsychosocial model, what we're doing is we're looking at, okay, what is the biology that's affected in this patient A? Well, she's sitting all day. She has pressure on her disc. She has pressure on her back. We know that sitting puts more pressure on your disc than standing. And moving, and movement is good for your whole back, all your joints in your body in general. But for patient A, so we're looking at her and we're saying she's got back pain. And we're not just going to adjust her, we're going to consider the biology of sitting, but we're also going to say, okay, the psychological aspect, where she's on the phone all day. And so she's having shallow respiration, she's having shallow breathing, she's under stress. So maybe patient A needs to go see a counselor or something as well to have other parts of her needs addressed. And then you could even go farther and say, what are the social elements that patient A is dealing with? What's her work environment like? Is she the bottom person on the totem pole? When she gets done work, is she stressed out and tired and goes home and sits on her couch and watches TV? So it's not as simple as just seeing a patient and being like, what treatments do I have? What do I have that I can deliver to this patient? You got to think, okay, what are the needs of this patient and why is she in the pain that she is in? And so that's what this biopsychosocial model, holistic healthcare, integrative medicine, and that's the whole push is towards that and trying to really figure out what's going on with patient.
Because each component of an individual is all interconnected and interrelated.
Exactly.
And
yes.
if one is effective, one aspect, if the physiologic is effective, it's going to affect the psychological, possibly in other areas of the person.
Of the person.
So
as well,
you
yeah.
address every component of that individual. That's the approach.
Yeah, and as
Awesome.
a team would be the important part, is working with MDs, working with social workers, working with counselors, working with even personal trainers, and working as a group.
So if an individual that you brought up the case scenario of this person who sits in the chair, if they were to take a home remedy, because a lot of people do that because of the cultural components of the individual, a lot of people have this home remedies that they may use. Is that a part of what you would support, home remedies?
Yeah, I would say that home remedies...
is that holistic?
Yeah, they can be holistic. They cannot be holistic. Wouldn't be a cut and dry answer. But home remedies are oftentimes very effective and very good, right? I mean, or what our mothers say or our grandmothers say is through the wisdom of their years. And that wisdom came down through their own personal experiences. And a lot of times that'll be like, you have back pain. Well, maybe you need to go out and walk. Well, maybe you need more exercise. You're not feeling well. Drink more water. These are kind of home remedies that you'll hear people say.
Yeah.
So
a part of it that you would do if you have a patient like this, you would listen to what they're doing and sort of guide them to something that's holistic that would incorporate every aspect of the individual to meet their needs.
Exactly.
Okay.
And I would say that's one of the challenges that patients face then as well in using a holistic style of treatment, is that they have to take a more active role in their treatment. And that active role oftentimes is more challenging, and it takes time. It's not just come to the chiropractor and get adjusted 3 times a week. It's you have to walk maybe and drink more water, do exercise. You have to do things that take time.
So it's all about behavioral changes and moving towards health.
Yes. Right. Yeah.
Awesome. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Janine Cook-Garrard, and I'm here with the nursing student Balia Wilson here at Nassau Community College. And today we're talking about holistic health care and chiropractic care with Stephen Pfieffer and John Mathai, who are both doctors of chiropractic candidates at Levittown Health Center. So tell me, you both are here and giving us very valuable information about what you have learned and the kind of practice that you're going to move very quickly in, because you both are interns.
Right. Yes.
Okay, awesome. So if I were to go to a healthcare practitioner, would one healthcare practitioner meet the needs of one individual better than another? How does that work with going to chiropractic? How does that work? Do you refer people to another healthcare team member, or is this sort of like a one-stop, we come to you and basically all of our needs can be addressed?
Well, we do refer out to other healthcare professionals. Like, there are chiropractic patients, and then if a patient comes in and they're not ideal chiropractic patients, like they have a condition that we can't treat, we try to give the patient the best care possible, and that's by referring that out to another healthcare professional. We will do that. But if they are a chiropractic patient, so we do adjust anything with the neuromusculoskeletal system. So if it pertains to the nervous system, the muscle system, or the skeletal system, they're ideal chiropractic patients. So that's basically what we treat inside the office and at our clinic.
And what are some of the pros and cons of holistic healthcare?
Well, I don't consider it a con, but for a lot of people, time. It takes a long time to get better.
We say advantages and disadvantages, pros and cons. But yeah. So
it takes some time, especially if you're chronically in pain for a bunch of years or a bunch of months, not one treatment is going to cure you in one treatment. It's going to take a while, and usually patients do get better. What we try to do inside the clinic is we try to empower our patients. We try to empower them, and we encourage them to take an active role in their care. So by taking that active role, they get better quicker. They're more engaged into their treatment, and overall that gets them better throughout their treatment.
How long is the program for chiropractic medicine? How long typically does it take an individual to go through the program?
It took us 3 years and 3 years, 6 months. For some schools, it's 4 years as well, so it's about average 3 years and 6 months.
And we go to school year-round, so we do 3 15-week trimesters a year, so we just go to school 45 weeks out of the year. And then our last year, between our 9th and 10th trimesters, we don't take a break. So it's essentially the same as 5 academic years, normal academic years, but it's compressed down because we go to school year-round. And then we take around 25 credits per semester. So.
And where are you interning?
At the Levittown Health Center in Levittown.
You're interning there?
Yes, we
okay.
are.
Okay. Just to switch gears, the Levittown Health Center also offers chiropractic services. Can you tell us about chiropractic care in particular? Is that because I know a lot of people think chiropractic and they think of adjustments.
Yeah. So chiropractic care, as we mentioned before, is a holistic type of care.
Right.
That's where our roots are in, is a holistic type of treatment, trying to look at the underlying cause and then working with other providers in order to.
So it may or may not include adjustments.
It may or may not include adjustments, yes.
Okay.
And so to carry on with that, it's a holistic style of treatment that is concerned with mechanical disorders. So if you're coming and we're getting treated by a chiropractor for their 10 treatments, then we're going to be dealing with, how are we on time?
You're good.
All right. We're going to be dealing with mechanical disorders of the musculoskeletal system. And so that's what a chiropractor would actually treat. And so, but as a primary care provider, it's just like if you go to any primary care provider, they're going to, they act as also a triage into other avenues of care for the individual.
When you adjust a person, and my husband has had adjustments before, it looks like it hurts. I don't know. Does it?
It doesn't hurt.
It doesn't hurt at all.
We've been adjusted 3 years straight, me and Steve-O, for school because we practice on each other, and it has no pain at all.
No pain.
No pain at all.
Do you have to prescribe any kind of analgesics after adjusting a patient?
No.
No, I haven't had to prescribe. I mean, sometimes patients will use something called BioFreeze on patients, but that's to help with the pain in the area of complaint. And so we have to keep in mind that when people are coming to the chiropractor, they're having pain in that joint, generally speaking. And so when they're coming, they have pain in that joint. They may get an adjustment and have a little bit of increase in pain momentarily, but that pain will, if the treatment is effective, is going to help to subside that pain, to decrease that pain.
So being adjusted, the goal is that they go home not hurting, but feeling better.
Yes, correct. The goal is leaving the clinic feeling better than when you came in the clinic. So
they may include heat therapy prior to the adjustments to loosen up the muscles and to...
We do heat. We do something called IFC, which is interferential current. We do therapeutic ultrasound. We do, we don't at the clinic, but there's diathermy. And in New York State is a little bit more restrictive on what chiropractors are allowed to treat. And in other states, they're allowed to do anything that a physical therapist is allowed to do as well. So it's really state dependent. But in New York State, those are the general techniques that we use as chiropractors.
And do people usually report that they feel better immediately, that they come in feeling in pain, and then by the time they leave, they're feeling alleviated in some way from the adjustment? Is that your feeling, or?
Yeah, I've had patients, and then they come into the clinic, they feel very tight and stiff and restricted in their neck and their low back, and after the adjustment and after some soft tissue and some exercises, they leave a lot better. They're less restricted, and they're able to move in less pain as well.
One more question before we go to break. Now, the need for adjustment, do you find that what really causes a person to need adjusting, is it more physiologic, or can it also be a stress-related issue that has a need for an adjustment?
It can be a combination of both. Yeah, because especially if you're under a lot of stress, a lot of people when they're under stress, they hike up their shoulders, and then that causes their neck to tighten up. And then with a little bit of like we do stretching, we do pending stretching with the adjustment, it releases that area, and what it does is increases your mechanoreceptors, which decreases the pain in that area that you're feeling and the stiffness in that area as well. Mm-hmm. So that's what the adjustment can do, especially if it's physiologic and structural as well.
Very interesting. Let's take a quick break. My name is Dr. Janine Cook-Gerard, and I'm here with nursing student Balia Wilson at NASA Community College, and we're talking about holistic health care and chiropractic care with Stephen Pfieffer and John Mathai, who are both doctors of chiropractic candidates at the Levittown Health Center. You're listening to Your Family's Health on the voice of NASA Community College, 90.3 WHPC.
You remember the day you first laid eyes on her. They handed you the keys and you drove back home for everyone to admire. And although the memories have been made, it's time to pass the torch to someone else. This year, consider donating your vehicle to the National Federation of the Blind. Just call 866-282-7327. Or if you know a blind person who needs help, please email nfb@nfb.org.
We now return to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thanks for being with us today. This is Dr. Janine Cook-Gerard from the nursing department here at NASA Community College. I'm here with nursing student Balia Wilson. We're talking about holistic health care and chiropractic care with Stephen Pfieffer and John Mathai, who are both doctors of chiropractic candidates at the Levittown Health Center. So, Balia, you have a question?
Yes. Is it safe or possible for a patient to adjust themselves?
Can you adjust yourself?
We don't recommend that the patient adjust themselves because they are moving joints. Generally speaking, when you adjust yourself, you're moving joints that are already moving well. And so because that's where the cavitation or that audible sound is going to come from, generally speaking. And so this can kind of create a cycle where you self-adjust over and over again. So the joints, though they're moving well, they start feeling tight. And so you're kind of you're stretching a joint that's already moving well over and over again because you're getting this. It's the neurology behind it is fairly complicated, but the neurology associated with that causes that you get that tightness feeling, and then you go ahead and adjust it again. I mean, the range of motion is still full, and because as a chiropractor, we're looking for areas in your spine that have a decrease in range of motion. Mm-hmm. And so joints that aren't moving well. Because joints that aren't moving well are getting a C fiber activation, what's called C fiber activation. That's what the pain travels on. And then you're getting a decrease in mechanoreceptor activation. By adjusting yourself, you're taking a joint that's already moving well and moving it more, which isn't particularly a beneficial thing.
Right. So you really have to understand what limb you're moving and the physiology behind every limb that you're moving to know when is too much to move it, moving it beyond the point of resistance. Do you move the joint beyond point of resistance, or is there a certain range that you know when to stop and when it's too much?
There is a range that we do know when to stop. There's the normal range of motion, and there's the paraphysiological zone. And once we get to that zone, that's when we do the thrust or the manipulation. So that's the safe zone. But if you go anything beyond that, that's when you can actually injure the person or injure yourself when you self-adjust.
I see. All right. So how about the nutritional counseling? Do you add any kind of nutritional counseling to the chiropractic care of your patients that you see?
Oh, yes, we do. So a lot of patients that we deal with, they have a lot of nervous system issues. So when it comes to them, we do recommend that we give them like a lot of B complex, because anything nervous issues, we would like to see they're usually depleted in B vitamins usually. So like to recommend that they take B vitamins. And then also a lot of patients come with chronic inflammation, so we try to give them, we have to look at if they have a pro-inflammatory kind of diet. So we look through their diet and see if they're eating a lot of red meats or anything that's very inflammatory. So we try to tell them or recommend to cut back on that and try to adopt more of a anti-inflammatory kind of a diet, which will help with that chronic inflammation that they're dealing with.
Mm-hmm. What would be an anti-inflammatory diet? Is that one that is plant-based, or is that what you recommend, or is it coming off of red meats? What exactly do you counsel students or patients to do?
So when they come into a consultation, we look at what they eat and how often they eat, and then just their basically dietary habits. So yeah, anti-inflammatory diets can be like plant-based, or it can be a reduction of eating the red meat. It can be a combination of both. But we just want to get away from the aggravating factor. And once we decrease the aggravating factor from their diet, then that can also potentially get them to the route that they need to be for better health.
Now, can anyone go into the center and go to the nutritionist, or what is the process of going to the Levittown Health Center?
I think you just call ahead, make an appointment. We do have Dr. Nurley there. He's the head nutritionist at the clinic. And I'm pretty sure the first appointment you're going to have is consultation. He'll go over what your diet is and whatnot, and then from then on, he'll treat you however often you need to be coming into the office as well.
Does he also do blood work as the beginning for assessing the individuals who come in for services? Is that customary that you do blood work?
I'm not sure if Dr. Nurley does blood work or not, but if it was a condition that needed to be treated or he thought needed to be treated outside of the office, he would certainly refer that person to the appropriate professional.
Are there other services at the Levittown Health Center that is provided outside of chiropractic medicine?
We do have acupuncture at the Levittown Health Center. There's an acupuncturist there, and so that service is offered. And as we mentioned before, we have patient education. We educate our patients, so that's something that people don't generally think of too much in terms of chiropractic care. And so, but we do a lot of patient education. It's a big part of our.
So tell me, besides cracking the back and, that typical back cracking, cracking the neck, I saw a wonderful documentary on someone who had it was sort of like a kyphotic hump, where their back was, really severely, they wasn't able to stand upright. And after chiropractic treatments, they were really able to assume an erect posture. So I thought that was quite compelling. But besides that, do you also treat nerve kind of pain, inflammations, sciatica, arthritis kinds of pain that patients may experience?
Yeah, I would say that's the majority of the kind of treatment that we do, is that nerve pain, because pain is carried through nerves, and so when you're having some kind of radicular pain, that's a big kind of treatment that we do. Degenerative joint disease or arthritis is something that we treat as well, because those joints oftentimes aren't moving well enough, and so we get more movement in them. And that, as we were mentioning earlier with the C fibers and the mechanoreceptors, where if you get those mechanoreceptors firing well, they override the C fibers, and joints that aren't moving well are in pain. You have pain in joints that aren't moving well. Like, that's why today in modern medicine they use the term MICE instead of RICE. So it's movement, ice, compression, elevation, because if joints aren't moving well, then they're degrading. And if they're degrading, then you're getting pain in those joints, and you're getting C fiber activation. But then when you get movement in those joints, you get mechanoreceptor activation. That suppresses that C fiber activation, and the joints have less pain, and they're not degrading. So you're getting a win in terms of you're not getting as much pain, and you're getting a win where the actual joint surfaces aren't breaking down, which is really big.
Awesome. That sounds just like a doctor, all of those technical terms. I love it. So tell me, I'm hearing that there's something being offered for Nassau Community College students. Tell me about that. Free? Am I hearing the word free?
It is free. It's complimentary for Nassau Community College students and faculty. Unfortunately, there's not a location on campus. You just have to have like a 10-minute drive to Levittown, but everything is free for Nassau Community College students and faculty.
So you said everything? Yeah,
chiropractic, everything that's chiropractic services.
And is that unlimited?
Unlimited. Come whenever you want.
Wow. Now I am impressed.
Yeah. That's just the chiropractic part, though, not the nutrition or the acupuncture. I don't believe is covered under that.
Oh, okay.
Just for the record. Sorry, guys.
Okay, so if you're Nassau, you have your ID, you can go in and make an appointment and get your chiropractic care.
Yep, correct. And that includes all the soft tissue, the interferential current, the stretching. We have flexion distraction, the heat, ice, whatever it is that the condition that you're presenting with. And we address that.
So outside of being a Nassau Community College person like me, who is going to come to your office, is services there covered by insurance, or is it out of pocket?
Well, most insurance do cover chiropractic, and so does Medicare. It does cover chiropractic service as well. Some people choose to pay cash anyways, so it depends on what their insurance is and if they have insurance or not. But usually chiropractic services are very affordable. It's very cost-effective long-term for a lot of people.
Yep.
Okay. And when you talk about, and we talk about chiropractic, your internship, you're in internship. How long is your internship, by the way?
It's been a year so far. We started in January, and then now we're ending in basically in November. So it's basically about a year.
So how many patients do you see in a typical year or over the month? What is the patient?
Well, we started seeing patients last September at school in upstate New York. So then we started at the Student Healthcare Center in Seneca Falls. I roughly saw that semester about maybe, 30 adjustments, 30 treatments. And then, right now I'm since January, I've seen about 260.
Wow.
Yeah.
260 patients?
No, treatments.
Oh, 260 treatments.
Yeah, so I have 260 treatments. So about, maybe with all that, I've seen about maybe 150 patients maybe.
Wow.
Yeah, it's from the clinic, and then we also treat patients in a lot of the SUNY schools. So we saw patients at Westbury, Farmingdale. There's a Salvation Army that we see patients in Freeport.
Wow, that's great.
Yeah, so we see a whole bunch of patients there as well.
Do you find that patients who come once will come back?
They do.
That they're recurring patients that come back because they see a benefit in coming back? Or is it that they become dependent upon, how do you separate? How do you know? Is that it?
I would say it's kind of like going to the gym and exercising. If it's like saying that going to the gym and exercising is addictive. Well, you go to the gym and you exercise and you feel better and your body's working better, and that's why you keep going back to the gym and exercising, not because you feel like you need to.
Oh, I see.
In that respect where it's like you have some kind of addiction or something like I'm in pain now and I have to go, or it's something that adds benefit to your life. And so that's why people keep coming back, because they're like, oh, I'm not taking drugs to relieve this, I'm not in as much pain as before, and I feel better overall. So they come back. I mean, that's you. If you leave somewhere feeling better than when you came in, generally you want to go back there.
You want to go back.
And that's just the way it is. I think just about any business can work by that premise.
Absolutely.
And how would people listening get in touch with you?
Well, first of all, you can start off by visiting the LevittownHealthCenter.com. That's our website, and you can see what services we offer at the health center. Or you can reach us at 516-796-4800. It's a 10-minute drive from the Nassau Community College campus, and it's right off Hempstead Turnpike.
I am scheduling my appointment. That's all I have to say. Thank you for being here, Stephen Pfieffer and John Mathai, who are both doctors of chiropractic candidates at Levittown Health Center. This is Dr. Janine Cook-Garrard, and I'm here along with Balia Wilson from the nursing department here at Nassau Community College, and we thank you for listening to this week's edition of Your Family's Health.
Thank you, Dr. Janine.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.